from Dr. Monforton, and you're recognized for 5 minutes, please.
Thank you, Chairman Tonko, Ranking Member Shimkus, and members of the subcommittee. I'm Dr. Celeste Monforton. I'm a lecturer at Texas State University. I have a doctorate and a master's in public health, and I've worked in this field for nearly 3 decades, including at OSHA and MSHA in the Department of Labor. I'm testifying today on behalf of the American Public Health Association, and I currently serve on the association's action board. I ask that my written statement and attachments be included in the record. APHA's mission is to improve the health of the public and to achieve equity in health status. Accomplishing these goals requires focus and attention on numerous social determinants of health, including exposure to toxic substances in the outdoors, in schools, in homes, and in workplaces. A decade ago, APHA called for a complete ban on asbestos. We have remained steadfast in this position, and it's the reason that APHA strongly supports H.R. 1603. There is no debate in the public health community that asbestos is a carcinogen, and there is no safe level of exposure. The comprehensive ban required under 1603 is on very strong scientific foundation. APHA applauded passage of the Lautenberg Chemical Safety Act and the decision by the Obama administration to choose asbestos as one of the first 10 chemicals subject to risk evaluation. EPA's recent decisions, however, call into question the current administration's willingness and ability to address the threat that asbestos poses to the public health. In its scoping document and problem formulation, EPA has essentially put a stake in the ground about what they will consider in their risk evaluation. These decisions include excluding cancers that are associated with asbestos exposure, including of the larynx, pharynx, ovaries, as well as pleural disease, excluding the exposure to asbestos-containing materials in the buildings, excluding exposure to asbestos in air, soil, and water, including disposal of asbestos-containing waste. With respect to the reporting requirements and the analysis that the bill calls for with EPA, Labor Department, and HHS, it's critically important because we cannot prevent asbestos-related cancers if we don't have accurate data on where it's located, what condition it's in, how it's handled and disposed, and how many people are exposed to it. We also don't know who is importing asbestos, where it's being shipped, and where it ends up. H.R. 1603 will help to fill this significant information gap by requiring EPA and other agencies to assemble data to answer these questions. The bill embraces the fundamental principle of the public's right to know and will provide the information necessary to develop protective risk management plans. Asbestos is a potent carcinogen. More than 60 countries have banned asbestos because they recognize its grave risk to public health. It is long past the U.S. to do the same. Cancer takes a physical and emotional toll on a patient and their family. Cancer has economic consequences, more than $80 billion in direct medical care costs alone. Add to that the lost time from school and work, productivity, travel, and all the other expenses that go along with having a serious illness. Preventing cancer makes economic sense. On a personal note, at age 49, I developed cancer that had already spread to my lymph nodes. I lost more than a year of my life undergoing treatment. Cancer is scary. Like many cancer patients, I wondered, how could this have been prevented? For so many cancers, we don't know the answer. We don't know the cause. But for asbestos-related cancer, for mesothelioma that killed Alan Reinstein, it is lethal. And we know exactly how to prevent asbestos-related cancers, eliminating exposure to asbestos. And that doesn't mean continuing to import it and claim that it can be handled safely. It's for this reason that APHA supports strong and comprehensive legislation that will ban asbestos, address the risk for the millions of metric tons of asbestos that's in buildings, homes, schools, and other structures, and assures the public's right to know. H.R. 1603 accomplishes these goals, and APHA wholeheartedly supports it. Thank you.